Hello, and welcome to the August video for Critical Care Medicine. In the August issue of Critical Care Medicine, there is a feature article, Outcomes, Characteristics, and Physiology of In-Hospital Cardiac Arrest in Children with Sepsis by Ryan Morgan and colleagues. And I am truly fortunate to have two experts, Paul Checchia and Michele Mariscalco, here to talk a little bit about sepsis-induced cardiac arrest in children. So as both of you know, I'm an adult intensivist, and so I'm hoping that you might tell me how important a problem sepsis-induced cardiac arrest in children is. Paul, would you care to start?
Sure. Yeah, the idea that the cardiac muscle is impacted by sepsis is known in pediatrics just like adults. So it is a huge problem in terms of cardiovascular instability with sepsis, shock states, cardiogenic shock states. I think one thing that we have both an advantage and a disadvantage of is we an advantage that our kids don't have coronary artery disease like adults, so they don't come at it with sort of one hand tied behind their back when they have sepsis on top of it. But it's a disadvantage because I think we also, and Michele can speak to it, we don't necessarily always think that the root cause is going to be cardiac injury. We think of more of the entire cardiovascular system and how it's deranged. But in the end, there is still the final common pathway that the heart is injured in a septic shock state. So I think it is a significant problem. It's just a question of how much we recognize it and what we're going to do about it. I don't know, Michele, if you have the same thoughts.
Yes, I think this is Paul, you did a great job of summarizing. Uh, we do recognize that cardiac arrest in children that go without long time without recognized sepsis and septic shock is the final common pathway. Yes, they may have a respiratory arrest ahead of time earlier, but invariably the cardiac arrest happens soon thereafter. So it is, and the problem's actually bigger than we realize because we're only recently being able to get our arms around the fact of how much sepsis there are in children writ large across the world, and in particularly in low and lower income countries and middle income countries, to really recognize the problem that we're having. And so this is a really important article because of that. So I agree with you, Paul. Thanks.
Thank you so much. So, Michele, I'm wondering if you could talk for a moment about whether there are any specific treatment issues that arise to patients, to children with sepsis that might be different than those for those who have cardiac arrest from other causes.
Yeah. Thanks, Don. It's a great question, and look forward to hearing Paul weigh in as well. But really, it also goes to the importance of this paper. So, as opposed to our adult colleagues, when it comes to resuscitation, in which there's a pretty long history of rich data over many years, the pediatric resuscitation group has been working very hard over the last 10 to 15 years to really wrap their arms around resuscitation in general for kids. And as a result of this, we have now some much better guidelines than we used to in regards to resuscitation for children. The question that was really being addressed by this paper, I know we're not going to talk about the paper that much, is this concept of how much stabilization do you need to do during the arrest? And that's really the key issue of the paper that we're looking at here, which is surprisingly not much different than if you don't have sepsis. And as far as your parameters and how long it takes you to resuscitate and which your blood pressures to do, it actually is quite similar to those children who have successful resuscitations as a result of non-sepsis. And that's a really important piece that now needs to be teased apart in other ways. Paul, anything else to add as a result of this?
Yeah, I think from a therapy perspective, maybe I'm starting to show my age in terms of my career is it starting to come to the final chapters, but I'd rather avoid the arrest. And so the therapy within that realm of the resuscitation starts to kind of fixate on things that I just think we've missed the boat then if we're talking about therapy during the arrest. I go back to one of my first mentors when I was a med student. It was like, pediatric patients don't just up and die. They give you a warning sign. Unlike adults, again, referring to coronary artery disease, where you may be walking down the street and have a massive MI, but kids always give you the warning sign. We're just, whether we're smart enough to see it or not. And so the therapeutic interventions when it comes to cardiac arrest and sepsis, to me, really kind of pivot to the therapeutic considerations during resuscitation, as the article has stated and as Michele has stated, in terms of just good basic therapeutic interventions during the pre-resuscitative phase and the resuscitative phase during the shock state, not just the cardiac arrest.
So I would like to thank our two experts, Doctors Checchia and Mariscalco, for joining me on the August video for critical care medicine. For those of you who are interested in learning more, please look at the article, Outcomes, Characteristics, and Physiology of In-Hospital Cardiac Arrest in Children with Sepsis, that can be found online in the August edition of Critical Care Medicine. Have a good day.